I think by and large, physicians were not captivated by the traditional philanthropy model that has been, and I believe still is in place in many, many health systems across the country. The gratitude model is very different. There are literally hundreds of peer-reviewed research publications that document that a culture of gratitude not only supports philanthropy, but it supports enhanced provider wellness, reduces burnout, improves patient satisfaction. We know that there are many, many needs that our clinicians have across the system, and they can vary from medical equipment to research equipment to research staff, employees, physical plants, I mean, a host of things. And the reality of the situation is that MedStar, as valuable and important and meaningful as those needs are, MedStar can't fill all those needs. And so there's a gap there that philanthropy fits perfectly into.
The true definition of philanthropy. You know, it's a Greek word, philanthropos, and translates to the love of humankind. Talk a little bit about that, of what initially could strike fear and anxiety in a physician, and how our model is different and why it shouldn't.
The story that I like to tell, a very philanthropic patient, philanthropic in the broader Baltimore community, who came to me after having had surgery at another institution out of state with a significant problem with his knee. And it turned out that we wound up having to operate on him, I think on Christmas Eve, to get the problem resolved. Fortunately, we were able to do so. And when he came back for his first post-op appointment, he offered to give me $20,000. He wanted to write me a check for $20,000. And I was taken back by that, but fortunately I was, almost jokingly, I said, we have a lot bigger plans for you than just $20,000, and not for me personally, of course. And I think subsequently he has become easily a six-figure donor to several important orthopedic and MedStar initiatives through that initial encounter. You know, we saw incredible gestures of gratitude come from people who maybe hadn't been patients, or maybe their family hadn't been patient, but they simply saw and recognized the great commitment and oftentimes the great sacrifice that our healthcare providers were giving to care for COVID patients. And they reached out and they'd bring meals and they'd bring food and they'd do everything they could. And it's not anybody's fault. It's the reality of the healthcare environment that we're in, the economics of the healthcare environment that we're in. And so philanthropy is a key partner to our providers. And I think once they recognize that, it even gets them more engaged.